But that's not all enough in terms of cost. You're also going to pay more in insurance premiums. And not everybody will, but you will. And it works this way. There's a bunch of insurance reforms in this bill, these bills. And you hear these talked about in ways that are very benign, particularly and sound very good. One of them is talked about all the time. It's talking about we have to eliminate the use of pre-existing conditions for health insurance. You know, and you'll hear these stories, and they're really tragic, and you understand why they want to fix this. Now, it is a little bit, I have to tell you, eliminating pre-existing conditions for insurance is a little bit like being able to drive your car into a tree and then pick up the phone and say, hey, Geico, I've been really meaning to get that auto insurance. Now's a good time. But, let's leave that aside. If you're going to say that people can wait until they get sick before they buy health insurance, why would anyone buy health insurance when they're healthy? And second, they're going to include something called community rating. And what community rating means is you can't take someone's health or age or sex or other condition, medical condition, anything like that, into account when you figure out what their health insurance premium is. You have to charge everybody, in the purest form of community rating, you charge everybody exactly the same premium. Doesn't matter whether the person's an 18-year-old marathon running, non-smoking, non-drinker in perfect health, or whether they're 63 years old with stage 4 cancer, weigh 400 pounds, sitting on the couch, and smoke 6 packs a day. They all pay exactly the same insurance premium. Now, if you do that, what's going to happen? You're going to bring down the premiums for the older sick person. They're going to pay a lot less. And people today who are elderly, who are in the 50s and 60s, people who are sick today, their insurance premium is going to go down. And people who are young and healthy, folks in this room, you're going to pay more in order to subsidize those people who are older and sicker. So your insurance premiums are going to go up, and the study suggests your premiums will go up between 75 and 95% in order to bring down the insurance premiums for people who are older and sicker. So there are winners and losers. Old and sick people win, you lose when it comes to this type of insurance premium. So you're going to pay more in the end. We're going to pay more in taxes, we're going to pay more in debt, and we're going to pay more in insurance premiums. And you guys are going to get hit with all three. Some of us are only going to get hit with a couple of them. Last question, then I'll open it up. Is there rationing in these bills? The short answer is maybe not. There is no, and I have to say, with fairness to the bills, with fairness to the president, and with all due respect to the former governor of Alaska, there are no death panels in this bill. There are no provisions to put grandma on an ice floe and sail her out to sea. That said, there are some minor provisions that cut back care under Medicare, for example. There is a provision that penalizes doctors who are in the 90th percentile of procedures scheduled. So if you're a doctor and you do the 90th percentile of surgeries or whatever, your reimbursement rates will be lower than somebody who only does the 80th percentile of surgeries. So you're going to have, think twice about doing some of those surgeries if you get up there in terms of numbers and things like that. There are cutbacks in reimbursement for imaging services like MRIs and so on that they think we do too much of. So there are cutbacks there. But for the most part, there's no direct rationing in the bill. On the other hand, if you look at this and these cost figures, and you look out there in the future, you realize we can't pay all the benefits that are being promised. Medicare right now is $50 to $75 trillion in debt. It cannot pay the benefits of this promise in the future. There's going to be rationing under Medicare now. There's going to be rationing under this plan. Now, I have to say something in fairness to rationing. Rationing gets a bit of a bad rap. Of course there's rationing in healthcare. There's rationing in healthcare now. And there'll always be rationing in healthcare. People ask me, one of the fun, questions I get all the time is healthcare a right or a privilege? Well, it's neither one. It's a commodity. And it's a finite commodity. Whatever our good sentiments are, there are only so many doctors, so many hospitals, and so much money. We're not ever going to provide unlimited health care to everyone. Healthcare will always be rationed in some way. The question then isn't, will we ration? It's who will ration? And how will we ration? Now today, we tend to allow insurers to do a lot of the rationing. Simply moving that to the government and allowing government to do the rationing isn't necessarily an improvement. I would much rather shift more of that power, money, and decision-making back to individuals and let individuals make rationing decisions based on price versus quality, a value judgment. Because value ultimately is idiosyncratic. What is valuable to me may not be valuable to someone else, and I don't necessarily know that a third party can make those decisions for me. But there's going to be some kind of rationing. If you go to a system under which private insurance has largely been squeezed out, and we end up with most Americans in a government-run system that cannot pay the benefits that have been promised, all those rationing decisions are going to end up being made at the government level rather than at the individual level. So I think ultimately you're setting the stage, not just for rationing, which stage is always going to be there, but for rationing that's not responsive to the individual. Let me close with this. I think, I've given a lot of numbers, a lot of details to Bill, but I think understanding healthcare reform is really very simple. And it all boils down to one question, and it's the same question that I think marks all political debate. All political debate throughout history, in fact. All the isms that are out there. Liberalism, conservatism, libertarianism, socialism, Marxism, whatever ism you want. They all come down to a single question. Who decides? Pick your issue. Who decides where your kids go to school? Do you, or does someone else make that decision for you? Who decides what charity you're going to support? Is that your choice or someone else's? How about who decides who you can marry? Do you get to make that choice for yourself, or does someone else make that decision for you? Who decides how you're going to save for your retirement? Is that up to you or someone else? And when it comes down to healthcare, who ultimately is going to make some of the most important personal and private decisions in your life? Are you going to get to make those decisions, or are those decisions going to be turned over ultimately to someone else? If you come up with the answer to that, then I think you know a lot about which way healthcare reform should go. Thank you all very much. Appreciate it. Appreciate taking the time.